Live, local. This is Fox 12 Now.
Hello, everyone. This is Fox 12 Now. I'm Greg Nibbler. Thank you for joining us. We are live streaming here out of the Fox 12 Oregon newsroom, as we do every weekday, starting around 1 p.m., covering a wide range of topics. Today, we are talking about the Providence Healthcare Worker strike, which began today, January 10th, Friday. 5,000 healthcare workers in the region at various different Providence locations are on strike, most of those including nurses, but also other healthcare workers, even physicians at a couple of locations. But that is something that you can check up on at KPTV.com. What we are talking about here today is Representative Maxine Dexter, who she is a congresswoman representing Oregon's District Number 3, and she is a physician. She weighed in on her thoughts about the current strike, her support for the nurses and the healthcare workers in the situation, and her general thoughts on the outcomes and what Providence should do or could do. We'll let her speak for herself. I spoke to her earlier today. Afterward, we do have a statement from Providence. We also discussed how this affects patients, which of course is a very important thing throughout all of this. But here we go. Here's Representative Maxine Dexter. Congresswoman, thank you for having some time to talk to us. Obviously today, depending on when people are watching this, the Providence strike began, 5,000 healthcare workers on strike, and you have obviously a very personal history with working in the medical industry, and I wanted to start off just by getting your thoughts on this strike and where we're at currently.
Yeah, thank you so much for your coverage and taking the time. Fundamentally, the strike is about protecting patients. Our caregivers are not feeling supported and aren't feeling that they have the safe staffing that they need to be able to optimally take care of the people in our community.
And, to that extent, what are some of the major issues that you see? Obviously, we've seen some of these publicly stated, but just to hear it from you, some of the major issues that you think are of concern.
Yeah, we are continuing to feel overstretched, and I say we, knowing that I no longer am taking care of patients, but that just ended. And what is clear is people are feeling overworked. We have historic capacity needs in our hospitals. We're having challenges transferring patients to the level of care that they need. And part of that is that we just aren't retaining and attracting the care providers that we need. So we need good paying jobs and safe staffing levels so that people will stay and care for people. This is becoming a mounting crisis.
When you talk about retaining healthcare workers, so where are those workers going? Is it other places with better wages, benefits, other states? What are some of the big competitive, aspects of that prevent these healthcare workers from retaining their positions there?
Sorry about that. Yes. Well, number one, we have a physician shortage, we have a nursing shortage, and this is a supply and demand, a mathematical issue. If you can't retain and attract the workers, you won't have enough to care for our patients. And no matter how many jobs are open, you can't fill them if you don't have good environments for people to work in and good wages. And that is foundationally what our care providers are asking for.
Would you look at it from that standpoint as far as, availability of people to fill those positions? Is this something from the ground up as far as there aren't enough candidates out there to begin with, going through school, getting their degrees in this, or is this just simply that Providence isn't competing from your standpoint for those other workers?
Yeah, thanks so much for the question. This is, without a doubt, a national issue. We have a supply issue of healthcare workers, physicians, nurses across the board. So part of it is that the education takes a long time, it's expensive, and if you can't make a good living at the end of all that, there are other areas where these smart, caring people will go. At the end of the day, these are mission-driven, hard-working people who want to care for patients. And so attracting those people means treating them as the professionals that they are, making sure that they have the opportunity to give the care that they want to be able to give. And when you erode that, it is really hard for someone to stay in the practice. So it's not just getting people in the door, it's keeping them there. And, speaking really personally, if you don't maintain that professional sort of ability to control your own environment, make sure that you can give the optimized care, people will go elsewhere. This is, especially for physicians, there's a shortage everywhere, and they're very mobile. They can pick up and move because of the relative salaries that they give. For our nurses and other allied health professionals, that's a much harder thing. And so they're caught. They need to be able to support their families. And we all know that the cost of living is going up, and we need to make sure that these providers get the support that they need financially, but also, and I think more importantly, in the workplace.
When you look at it from talking about Providence itself and from their standpoint and from their negotiations saying that they believe that they've offered, a competitive salary and from their package, clearly that's not what the nurses feel, and that's why the strike is happening. But looking from Providence's standpoint, where do you think are things that they can improve on, or how they will even fund some of the asks that the nurses are asking for, the healthcare workers?
I have no doubt that every system, including Providence, is under stress right now. Our health system is not working, and fundamentally, that's why I'm here in Congress. We have to do better, and the system is getting squeezed on all ends. And so I understand the ability to maintain a functioning system is really hard if you're continuing to pay more and more for labor. But at the end of the day, this is a supply and demand issue. And if you can't provide the care without the providers, or you can't provide the care without the providers, you've got to be able to pay them and maintain a system that they will stay in. And so centering the patients is my first priority, making sure that they can get the care. I am going to go to bat here in DC, and I know many of us are across the state and everywhere, trying to make sure that we can fix the healthcare system. But that's a long-term issue. The short-term issue is patients need a safe place to get care.
When I guess there's two things to address there, but one of them just talking about the congressional side of thing, and you being there right now, which congratulations, by the way. To that side, to that point, do you anticipate any kind of congressional or governmental interaction when it comes to this strike in particular with Providence and the Oregon Nurses Association and the other healthcare workers?
I sincerely hope not. This is a contractual issue between an employer and employees. If government has to get involved, it's taking too long. So my ask is that everyone gets to the table and does, in really good faith, their best to make sure that we get a fair contract for our workers.
When you talk about the patients, which obviously is a concern, there are a lot of patients who are going to have their healthcare affected during this strike. Have you heard from any feedback from them, from the patients who would be normally going to one of these organizations right now?
Constituents some concern about access to care, and the number one thing I think people need to understand is seeking care is absolutely the right thing to do. So if you need care, going into a Providence facility or wherever your care is given is absolutely the right thing to do. So number one, I think people are worried about whether or not it's okay to cross picket lines and whatnot. Everyone wants our patients to get the care they need. So making sure that that is clear, I think, is a very important public service that you are providing.
And, to that extent, too, one thing that's certainly a concern for some out there when we talked about obstetricians and along those side of things, how do you anticipate that affecting some of those people out there where that's going to be probably an immediate thing where they need to go in? And if they are not able to get to the clinic that they normally go to or be able to get access there, how is that being addressed?
Yeah, look, I'm not sure how it's going to be addressed in this specific moment in time yet. What I do know is there is going to be capacity constraints. Patients will need to get care. If you can't get care at the facility that you expect to be able to get care, you need to get care wherever you can. And in emergency situations, hopefully that is not what we're talking about here. Hopefully you can call and get rescheduled and make sure that you can get access. But if you need care and you don't have a clinic that you usually go to that's open, going to the nearest clinic is always, or hospital, it's always the right thing to do. And if there are concerns around billing and other things, I will just share that our office and many other elected officials will be happy to help facilitate that.
And when you talk about that for facilitating, could you just explain that for people out there who would want to contact you, what exactly you would be able to facilitate?
The number one thing is insurance companies understand that if you can't get care at your normal facility, that you will get coverage. That is almost assuredly going to be where most insurance companies land, and patients will get the access and the coverage that they need. If there are concerns around that, you can always call, the membership services is what it is in some systems, whoever it is, to make sure that you're asking these questions. But ultimately, if you're not getting the answers you need, elected officials are also able to help.
Right. Anything else that you think is important for people to know about this particular strike as it's just beginning here today?
Yeah, this is historic. Physicians and nurses going out on strike together is really a statement about the concern that they have, and that they need to be able to be in safe and supported working conditions. And frankly, I think that it is reflective of our system. And so making sure that people like me understand what the challenges are for you, reaching out, letting us know in this moment in time what the impacts are, is really going to help me get what I need done for people in places of power in Washington, D.C., and for our state workers, so for our state elected officials. I hope people don't feel that this does impact them. It's certainly the hope that this is over quickly, but sharing those stories and making sure that we understand the impacts is really important, because we all understand that the system is not working as it should.
Really quick to that point, as you mentioning that the system is not working as it should, do you have any proposals or plans to work on legislation to address some of these issues that you're bringing up?
Yeah, these are very similar proposals and ideas that I had at the state level. I'm in my first week here, so we don't even have committees yet, so there's a lot of work to come. But I ran for office because I want to make sure that people can get the care that they deserve and that it's affordable, accessible, and sustainable. So I'm going to be going to bat here, but we have people across the state at every level of government who are really working hard for this. And at the end of the day, it's going to be the voters who help us get that done. So that we just all need to make sure that we continue to prioritize a healthcare system that works.
All right. Well, Congresswoman, thank you very much for having some time to talk to us. Hearing this side of it and understanding that, as you mentioned, this is an historic strike that is happening right now, and what's going on with that. And so we'll hope that there's a resolution that we'll find out here soon. So thank you very much for being with us today.
Thank you so much for your coverage. Take care.
All right, and I did reach out to Providence for an interview. I've not heard back from them yet in relation to this interview that I had with Representative Dexter, but we do have a statement from them addressing the strike as far as the replacement nurses. So this is their statement right here. We have completed our transition to our temporary replacement workers at all 8 hospitals in Oregon. We are running our operational plan and taking care of patients. That's from Gary Walker, Executive Director of Communication for Providence, Oregon. So wanted to make sure that you had that there. We also have a lot of coverage at kptv.com. We have reporters out on site who have been doing interviews. So there's a lot more for you to find there if you'd like to continue finding out more about this story. And of course, on other newscasts later today, we'll update you if anything changes, and we will go from there. But this is Fox 12 Now. We live stream here from the Fox 12 Oregon newsroom. I appreciate you joining us. You can find all of our segments on our YouTube channel. I always want to make sure that you know that if there's ever breaking news, this is the place to go between 1 p.m. and 4 p.m. every